Welcome to the Discourse Analyzer AI Toolkit, where articles come alive. You're listening to the audio version of our article. For the full text and an interactive experience, check out the link in the description below. Interact with any selection using our AI assistant to enhance your understanding. Let's explore.
Public health messages in Discourse Analysis. Interactive assistant public health messages are communications designed to inform, educate, and guide the public on health-related issues. These messages, which are typically delivered by health authorities, governments, and organizations, play a crucial role in shaping public behavior and attitudes toward health practices, disease prevention, and risk management. In discourse analysis, public health messages are studied to understand how language constructs health knowledge, encourages behavior change, and reflects societal values, power relations, and ideologies. Discourse analysis of public health messages focuses on the language strategies used to communicate with diverse audiences, how authority is constructed, and how messages frame health issues and their solutions. By analyzing the rhetoric, tone, and framing of public health campaigns, government advisories, media reports, and social media posts, discourse analysis reveals how language can motivate, persuade, or, in some cases, stigmatize or exclude certain groups. Key features of public health messages in discourse analysis. 1. Framing of health issues. The way health issues are framed in public health messages significantly impacts how the public perceives them and responds. Discourse analysis examines how health risks, preventive measures, and solutions are presented and how this framing influences behavior and attitudes. Example: during the COVID-19 pandemic, messages like, "We're all in this together," "Stay home to save lives," framed staying at home as an act of solidarity and collective responsibility. Discourse analysis would explore how this framing appealed to social unity and responsibility, motivating compliance by aligning individual actions with broader societal goals. 2. Use of persuasive language. Public health messages often employ persuasive language to encourage individuals to adopt health-promoting behaviors. Discourse analysis looks at how rhetorical strategies such as appeals to emotion, logic, or authority are used to persuade and influence public behavior. Example: a vaccination campaign might use phrases like, "Protect yourself and your loved ones," "Get vaccinated today," appealing to both individual protection and familial care. Discourse analysis would investigate how this language evokes emotional responses, such as concern for loved ones, to motivate vaccination uptake. 3. Scientific authority and credibility. Public health messages often rely on scientific authority to establish credibility and legitimacy. Discourse analysis examines how language invokes scientific expertise, statistics, and research to persuade audiences and guide health-related decision-making. Example: a public health message about a flu outbreak might state, according to the CDC, "The flu vaccine reduces your risk of infection by 60%, using scientific data to back up its recommendations." Discourse analysis would explore how the use of scientific evidence reinforces the message's authority and helps to build trust with the audience. 4. Risk communication. Public health messages often center around risk communication, which involves conveying potential health threats and guiding individuals on how to minimize them. Discourse analysis investigates how risks are communicated, how uncertainty is managed, and how different audiences are advised to respond. Example: in a message about food safety, public health authorities might say, "Cooking meat thoroughly reduces the risk of foodborne illness," emphasizing a preventive action while downplaying the severity of the risk if the advice is followed. Discourse analysis would explore how the language balances informing the public about the danger without inciting unnecessary panic. 5. Inclusive versus exclusive language. Discourse analysis also examines whether public health messages are inclusive or exclusive in their language, considering whether certain populations or groups are addressed, represented, or marginalized. This includes looking at how language can either include diverse audiences or alienate vulnerable populations. Example: a sexual health campaign might say, "Protect yourself by using condoms," but might exclude LGBTQ+ individuals or non-heteronormative relationships if it doesn't address diverse sexual behaviors and health risks. Discourse analysis would investigate how the message's language fails to include all demographic groups, limiting its reach and effectiveness. 6. Normative language and behavioral expectations. Public health messages often promote specific behaviors as normative, encouraging compliance by framing these actions as what everyone is expected to do. Discourse analysis looks at how language constructs social norms and the pressure it places on individuals to conform. Example: a message on hand washing might state, "Everyone should wash their hands for 20 seconds to prevent the spread of germs," using normative language to establish hand washing as a social expectation. Discourse analysis would explore how this creates a sense of duty or social responsibility, and whether it makes non-compliance seem abnormal or socially unacceptable. 7. Crisis communication and urgency. During health crises, public health messages often emphasize urgency and immediate action. Discourse analysis examines how language is used to convey the seriousness of a situation and to spur quick behavioral responses, often by evoking fear, responsibility, or a sense of emergency. Example: in the early stages of the COVID-19 pandemic, messages like, "Now is the time to act," "Flatten the curve," were used to emphasize the need for immediate action to reduce infection rates. Discourse analysis would investigate how the language creates a sense of urgency and compels swift behavioral changes to prevent further harm. Methods for analyzing public health messages in discourse. 1. Critical discourse analysis, CDA. Critical discourse analysis, CDA, examines how public health messages reflect and reinforce power relations, ideologies, and social hierarchies. CDA focuses on how authority is constructed, how certain voices, such as health experts or governments, dominate discourse, and how others, such as vulnerable populations, may be marginalized. Example: a CDA of COVID-19 public health messages might reveal how governments used expert authority to control public behavior through mandates and recommendations, while marginalizing alternative voices, such as frontline workers or community leaders. The analysis would focus on how power was asserted through language during the pandemic. 2. Frame analysis. Frame analysis investigates how health issues are framed in public health messages, focusing on how specific aspects of a health issue are emphasized while others are downplayed or omitted. This method helps to reveal the underlying values and assumptions driving public health campaigns. Example: a public health message about smoking cessation might frame quitting as a personal responsibility with phrases like, "Take control of your health," "Quit smoking today," focusing on individual empowerment while downplaying societal factors such as advertising or peer pressure. Frame analysis would explore how this framing shapes public perceptions of smoking cessation as a matter of personal choice. 3. Risk communication analysis. Risk communication analysis examines how public health messages convey risk, uncertainty, and guidance for mitigating threats. This method looks at the balance between clarity, technical detail, and emotional appeal, exploring how messages guide public behavior without inciting panic. Example: during an influenza outbreak, a public health message might say, "The flu can be dangerous for older adults, but getting vaccinated can reduce your risk," combining factual information with a call to action. Risk communication analysis would explore how the message balances communicating the danger with offering a clear solution. 4. Semiotic analysis. Semiotic analysis looks at the use of signs, symbols, and visuals in public health messages, exploring how these elements complement or reinforce the written or spoken message. This method is particularly useful for analyzing public health campaigns that rely heavily on images or infographics. Example: a hand-washing campaign might include a poster with step-by-step images of proper hand-washing techniques alongside text explaining each step. Semiotic analysis would investigate how the visual representation reinforces the importance of hand-washing, making the message more accessible and actionable. Examples of public health messages in discourse analysis. Example 1. COVID-19 mask-wearing campaign. A public health message might state, "Wear a mask to protect yourself and others," framing mask wearing as a collective responsibility. Discourse analysis would explore how this language promotes solidarity and individual responsibility, emphasizing community protection to encourage compliance. Example 2. Anti-smoking campaign. An anti-smoking campaign might use the phrase, "Smoking kills, quit today," framing smoking as a deadly risk that requires immediate action. Discourse analysis would examine how the language appeals to fear and mortality, creating urgency to persuade individuals to quit smoking. Example 3. HIV/AIDS awareness campaign. An HIV/AIDS awareness message might say, "Know your status, get tested today," using direct, empowering language to encourage individuals to take control of their health. Discourse analysis would investigate how this message frames testing as a proactive, responsible choice, reducing stigma around getting tested for HIV. Example 4. Flu vaccination message. A public health message during flu season might state, "The flu vaccine is safe and effective. Get vaccinated today to protect yourself and your family," combining scientific authority with a focus on protecting loved ones. Discourse analysis would explore how the language builds trust in vaccination while appealing to familial care as a motivating factor. Example 5. Zika virus prevention campaign. A public health message during the Zika virus outbreak might advise, avoid travel to areas with Zika outbreaks if you are pregnant, combining a travel advisory with a focus on protecting vulnerable populations, pregnant women. Discourse analysis would examine how the message frames risk specifically for pregnant women and emphasizes prevention as a personal responsibility. Challenges in analyzing public health messages through discourse. 1. Misinformation and public distrust. In the age of social media and rapidly spreading misinformation, public health messages may be undermined by public distrust or competing narratives. Discourse analysts must examine how misinformation shapes the public's interpretation of official health messages and how this impacts behavior. 2. Cultural sensitivity and inclusivity. Public health messages may not resonate equally with all audiences, especially if they lack cultural sensitivity or inclusivity. Discourse analysts must explore how public health messages account for or neglect cultural, linguistic, and social diversity in their communication strategies. 3. Balancing urgency and panic. Public health messages must strike a balance between conveying urgency and avoiding panic. Discourse analysts must examine how language is used to manage this balance and how public reactions are influenced by different approaches to crisis communication. Conclusion. Public health messages are a critical tool for shaping public understanding, guiding behavior, and managing health risks. Through discourse analysis, researchers can explore how language constructs public health knowledge, mobilizes individuals to take action, and reflects broader societal values and power structures. Whether analyzing crisis communication, vaccination campaigns, or risk management strategies, discourse analysis reveals the complex ways in which language influences health behavior, trust, and compliance. Understanding the role of discourse in public health messaging is essential for creating effective, inclusive, and impactful health communication strategies. Frequently asked questions. What does discourse analysis reveal about public health messages? Discourse analysis uncovers how language in public health messages shapes public understanding, guides behavior, and reflects societal values. It examines how messages use rhetoric, framing, and scientific authority to influence public attitudes and compliance during health campaigns. How are health issues framed in public health messages? Health issues are framed to emphasize specific aspects, such as urgency, community responsibility, or personal protection. For example, during COVID-19, messages like, "Stay home to save lives," framed social distancing as a collective act, promoting unity and shared responsibility. How does persuasive language function in public health messages? Persuasive language appeals to emotion, logic, or authority to encourage behavior change. Phrases like, "Protect your loved ones," "Get vaccinated," leverage emotional appeals to motivate protective behaviors by associating them with personal and familial safety. What role does scientific authority play in public health communication? Scientific language and data establish credibility and legitimacy. Public health messages often cite reputable sources, e.g., according to the CDC, to build trust and persuade audiences to follow health recommendations. How is risk communicated in public health messages? Risk communication balances technical information with clarity and emotional appeal. For instance, messages about flu prevention might emphasize, "Get vaccinated to reduce your risk of severe illness," blending factual data with action-oriented language. What is the significance of inclusive language in public health messages? Inclusive language ensures that messages reach and resonate with diverse audiences. Discourse analysis highlights whether messages address or marginalize specific groups. A failure to be inclusive can lead to ineffective communication and reduced public engagement. How do public health messages create social norms? Public health messages use normative language to establish expected behaviors, such as, "Everyone should wear a mask in public." This type of language reinforces social norms, making adherence to guidelines seem standard and non-compliance appear socially unacceptable. How do public health messages convey urgency during crises? Language during health emergencies emphasizes immediate action, using phrases like, "act now" to flatten the curve. Discourse analysis examines how urgency is communicated to prompt quick responses while managing public fear. What methods are used to analyze public health messages? Critical discourse analysis, CDA, explores power relations and ideologies embedded in health communication. Frame analysis investigates how health issues are presented and prioritized. Risk communication analysis examines how risks are conveyed and balanced with solutions. Semiotic analysis analyzes visual and symbolic elements that complement language in public health campaigns. What challenges do discourse analysts face in analyzing public health messages? Challenges include misinformation, cultural sensitivity, and the need to balance urgency with preventing public panic. Discourse analysts must consider these factors when evaluating how language impacts trust, behavior, and inclusivity in health communication.